Hi again, we're here. I'm Darren Bernard. I'm here with Jonathan Walczak, consultant orthopaedic surgeon. We're going to talk a little bit about different types of surgical approaches for total hip replacements.
Good afternoon,
In no time.
Thank you for asking. There are numerous ways to approach a hip replacement, which there have been for 50, 60 or so years, and various people say one's better than the other. Everything's got its pros, everything's got its cons. But very simply, you can approach it through the back door, going to the gluteal muscles here, through the side entrance, to the side, or through the front. Each of them has increasing problems. Going through the front can cause more damage to nerves and more fracture.
Yeah.
Going through the back has increased risk of dislocation. I tend to go through a kind of hybrid of the back, of the side and the front, through minimally invasive, minimising muscle dissection and loss there. Every approach has pros and cons. You have to accept that there's going to be some limping for between 6 weeks and 12 weeks with whatever approach you do, but unless you've damaged the nerves during the operation, by 12 weeks with good physio, limp should be a lot less.
How do you size up your hip prosthesis?
We can do this there are templates to measure it on the x-ray. You can measure beforehand, but I've always found that if you do that, it's never that accurate because the x-rays aren't standardised. So it's a combination of trialling. You remove, when you've dislocated, look at the ball joint, take a measurement from there, measure the socket. We actually have 1 mil graduated reamers to get the exact size. You then put in a trial, and the one that fits the best is the one you use, both of the socket and of the femoral component or the stem. And then you've got a modular head. You can add different sizes of ball, different lengths of ball, different offsets, which is the gap between the ball and the stem, to get the stability, the leg length, and the balance right.
Yeah, and structure of the stem, structure of the ball. What type of? Are they different types of structure?
Certainly can be. I mean, there are two designs of hip replacement effectively: cemented, grouted in with basically epoxy resin cement, or uncemented. And there are various nuances. The cemented ones I'd use for older osteoporotic bone, which may fracture if you impact a pin into it. The younger bone, I'd usually use an uncemented pin, which is a roughened titanium alloy, which gets a grip on the bone. It's coated with a material called hydroxyapatite, like a coral, which basically tricks your body, thinking it's a piece of bone, to bond onto it. That's both the same for the cup and the pin. Then the femoral head, the ball, can either be good old-fashioned stainless steel or a metal alloy, but the best, hardest and long-lasting is a ceramic. It's a mixture of ruby and zircon, which is extremely smooth, extremely hard wearing, and one of the reasons why hip replacements used to last 10 years and now 80% will last 20 or even 25 years. So it's a quality bearings and good fixation to the bone.
And do you find that now they're talking about bespoke or made to measure hip replacements? What's your view on the bespoke one?
This has been around for a long time, even since I was a trainee. They used to call them CAD-CAM hips, computer-managed hips. Now there's companies who are doing it more bespoke. It's an excellent idea. It's extremely expensive. The problem is that you're relying upon the X-rays and CT scans. And so I've done these and literally taken the measurements and then found because it only fits one very specific shape, you haven't got the same flexibility. You can't rotate it or move it. It's where it is the computer says it must be. So I think if you've got very distorted anatomy, such as a childhood hip problem,
right,
or previous hip surgery, then it's worth doing a more bespoke. I think for the vast majority of people, it introduces almost inflexibility, and it's not necessary.
Thank you. So there you have it. I've learned a lot. Hopefully you've learned a lot. Stick around for the next series when I'll ask Jonathan about when people can return to particular sports.
Excellent.
Thanks for watching.
Good day.